I'm showing how you can go ahead and register to our portal. You can come directly to our website, and it's cancerclinics.com, and you can go to the portal registration area. When you go over here and you continue to the portal, if you have never been registered with us, you just go over here and press register now. And you can the area that has the asterisks, you're the ones that is mandatory to fill out. So we're just going to put over here Ellie, we're going to create a username, and we're going to create a and we're going to do the gender again asterisk, so we can do address, we can create put a number here too. And here is the one that we're going to create an email address, and put the email address. Not accepted because I think I had another email address associated with this one. And then we're gonna press next. And then here it is going to ask us what kind of a plan this is, or if it is United Healthcare, or it is for example, United Healthcare or UMR, which one are United Healthcare? Sorry, okay. And the address, you look at the back of your insurance card, and there is a PO box on the back of your card, and you select that one. And the policy number, you're going to put that number in here too. And the signature on the file, that's fine. And then the insurer person, and then we're going to go to the next one. Here is the medical history, and you can add the medical history that you have. If you have like diabetes, you can add the diabetes over here. I guess it will tell you that which one it is. If you want to select that one, the description, you don't need to status active. So you don't, it's not mandatory, but you can just keep adding hypertension. And the other one is add other medical history, for example, osteoporosis, if you have. And you can select that one, so you can keep adding whatever medical history that you want us to know that you have. And then you go to the next step. Here it is the social history, and you can see the tabs are going from the demographic, insurance, medical history to social history. And then again, you're not mandated. There's no stress over here to say that you have to answer this, but it would be very beneficial for us if you can do that. Then we don't have to ask you in the office to do it. If you're a social drinker, you can just say social drinker. If you're a smoker, an active smoker, you can say everyday smoker. And you can say if it's a cigarette and the frequency less than a pack a day, and length that they have been doing this for 10 to 15 years. And you can add that to drugs do not use. You can select that one. And then you're going to go to the next page. Here is the surgery history. If you had, mastectomy, for example, you can, left breast partial mastectomy, or whatever. If you had, for example, gallbladder surgery. You can write that gallbladder removal, and if you wanted, you can write all the information about it here too. The next one is the family history. If anybody in the family has, for example, breast cancer, and you can add that in here as well too, and some other family history, you can keep adding them. The next one is the allergy. If you are allergic to penicillin, and you can just select penicillin drug. If you're allergic to sulfa, you can add that as well too, and keep adding the information that you want us to know. After here is the a patient consent area. So one is the SMS text messaging from the surface and informed consent for the let's see what here it is the HIPAA. I'm sorry, this is first. The first one is the HIPAA, and it's very important that we keep your information confidential. So patient signature. So all you have to do is add, first name, last name, today's date, and then we're gonna go to the next one. If there is anything you don't want to do, that's fine. Telemedicine informed consent. Again, it's gonna be again your name. Here that you add that one, and then you go to the next page. Insurance allowance agreement. This one, we need this one because that tells us that we can go ahead and charge your insurance, and we have to the right of sending the bill to your insurance. And this one is AI scribing. So because we use the new technology, and in the room when we see you, we use this AI scribing. So this is again something that we would need your consent on. And SMS text messaging is because also we are now from our office number, the same number that we use to call us, the 936-439-5213. You can also text message us through that one. And this is the consent to that as well too. And the other one, informed consent and pain management agreement, you can skip this one because you're not doing the pain management with us. So we're just going to go ahead and finish. So I'm sorry, this one it is. So maybe we're going to have to, if needed for some people, we have to modify this one. And so you can go ahead and press finish. I do not want to press finish because I am not registering. This was just a test one, but this is all the process of registering, and you already have your user and password for this.